The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, editor of JACC, here with Inside JACC, and this morning I'm talking to Philip Moons, and Phillips is a member of the Center for Health Services and Nursing Research at the University of Leuven in Belgium. And Dr. Moons has been the senior author on a paper about to be published in JACC that deals with the interesting logistical issue of the transfer of patients with congenital heart disease from a pediatric setting to an adult congenital heart disease setting. So, Dr. Moons, let me ask you, what did your paper tell us that we didn't know before?
Well, when you read the literature, and we started our project with this thing, we were struck by the fact that 21 to 76% of patients born with congenital heart disease are lost to follow-up when they are becoming an adult. We did not have the same impression at our center, and that's the reason why we started the study to investigate the transfer destinations. Where are adults with congenital heart disease followed up when they are reaching adulthood?
And what did you find?
Well, in contrast with the majority of the studies, we found that only 7.3% in our institution was lost to follow-up, which means that only a minority of patients with congenital heart disease are no longer in follow-up when they are adult.
Well, that's really outstanding performance, because this is a very important transition from pediatric care to adult congenital heart disease care. What do you attribute your excellent success to?
Well, indeed, I think that the situation in our country and in our institution is not the same as in other institutions or other countries. I think a first component that could have led to this result is the fact that we do have pediatric cardiology and the adult congenital heart disease program in one hospital. So those two programs are under one single roof. The two programs also, and that's the second component, the two programs use the same database, and they are using the same medical records. So transfer of information is very easy in this respect. The two programs, and that's the third component, also use a visit reminding schedule, which means that patients are actively contacted when the next outpatient visit is about to come. Belgium has also, like several other European countries, we do have a compulsory health insurance system, which means that non-insurance and underinsurance is hardly a barrier for patients for receiving care. The fourth component is the fact that Belgium is also a very small country with a high population density. So patients do not need to travel for a long distance to have their appropriate care.
Well, it's clear that we could, outside of Belgium, learn some important lessons from your situation. It will be important, if I look at your data, for us in the future to try to link up adult congenital heart disease programs with pediatric cardiology programs, hopefully as closely as possible, both geographically and in terms of records. Thanks very much for being with us. For Inside JACC, I'm Tony DeMaria.